What historical dust diseases are related to COPD risk? Imagine working in a busy factory or a mine and not realizing that the dust you're inhaling could affect your lungs years down the line. Many workers in the past faced this silent threat, which has shaped our understanding of lung health today. Several dust-related diseases from history are linked to a higher chance of developing chronic obstructive pulmonary disease. These diseases mainly come from long-term exposure to different kinds of dust in workplaces. When dust particles are inhaled over many years, they can cause lung damage that may lead to COPD later in life. One of the most well-known dust diseases is silicosis. This disease happens when workers breathe in tiny particles of crystalline silica dust, which is common in mining, quarrying, and stone cutting. The silica dust causes the lungs to become inflamed and develop scar tissue, a process called fibrosis. Over time, this scarring makes it harder to breathe and can increase the risk of COPD. Even people who do not smoke but are exposed to silica dust for many years often show signs of lung problems similar to COPD. Another disease linked to occupational dust is coal workers' pneumoconiosis, often called black lung disease. It affects coal miners who breathe in coal dust regularly. The dust causes chronic inflammation and scarring in the lungs, which can lead to airflow problems. Studies show that the more dust miners are exposed to, the higher their chances of developing COPD. This is especially true for miners who also smoke, but even non-smokers are at risk if they have long-term exposure. Asbestos exposure is another historical dust disease. Asbestos fibers were once widely used in construction and shipbuilding. When inhaled, these fibers cause lung scarring and inflammation, which can contribute to airflow obstruction. This damage can develop into COPD or worsen existing lung conditions. People working with cotton or organic dusts, such as in textile factories, can develop byssinosis. This disease causes symptoms similar to chronic bronchitis, including cough and shortness of breath. Over time, it can progress to COPD, especially if dust exposure continues. Other dusts from industries like cement manufacturing, metal working, and chemical production have also been linked to lung damage. These dusts irritate the airways and cause long-term inflammation, which can lead to COPD. The common thread among these diseases is that they cause ongoing inflammation, scarring, and destruction of lung tissue. This damage makes it harder for air to flow in and out of the lungs, which is what happens in COPD. Smoking can make these effects worse, but even without smoking, long-term occupational dust exposure increases the risk. Understanding these historical dust diseases helps us see how workplace exposures can shape lung health. It highlights the importance of controlling dust levels at work, using protective gear, and monitoring lung health regularly. Protecting workers from dust exposure is key to preventing COPD and other serious lung diseases.